Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Now here along with Dr. Bonati, your host, Kimberly Brumell.
Thank you for joining us for American Medicine Today. I'm Kimberly Brumell, joined by our executive producer, Ethan Euchre.
Always a pleasure to be here.
And to the side over here, we have our esteemed senior fellow, Jeff Wagstaff.
It's great to be here. Thanks for having me.
Absolutely.
I always feel the
he's
urge
part of our
to
think tank.
I always feel the urge to make fun of him just because I know Jeff personally,
Yes.
and he has this vaunted title of esteemed senior
Yes.
fellow. So
And then he jokes around.
around.
But I
mean,
try to
look
be
at the guy.
I try to be really serious and on point when we do American Medicine Today.
Well, of course, we all
Well,
do.
when we hit Obamacare, that's when he gets very serious.
That's true.
Yes.
But he is our fellow, so
Yes.
Okay.
And
Special guest.
Yes. We have board-certified neurosurgeon, Dr. John Grossmith. Thank you for being here.
Okay, good afternoon. Thanks for having me.
if anyone in this room is esteemed, it's
Yes.
this guy right
Yes.
here, Dr. Grossman.
Yes, he is. He is one of the many highly skilled surgeons that was trained by Dr. Bonati in the Bonati spine procedures. And, you know, when you hear minimally invasive, it's not synonymous with the Bonati spine procedures. What sets the Bonati spine procedures apart is that the doctors and Dr. Bonati were able to exactly get to the root of somebody's pain, and they're able to resolve it. So it's not just that, hey, we performed surgery. It's we really were able to resolve that patient's pain and get them back in motion, help them regain their strength and their hope. Because what we're hearing week after week from these patients is that there was no hope. Doctors telling them there was nothing that could be done, or they could go through invasive spine surgeries and then they'd be exchanging one pain for another. But Dr. Bonati was the one that saw the problems with traditional open back and neck surgery, and he sought out to find a real resolve. And that's what he did with the Bonati spine procedures and the tools, the patented instrumentation and the methods to really bring that to fruition. They have over 98.75% patient-reported satisfaction, and that is amazing, and that is why Bonati succeeds where others fail. With that said, we have Richard London, author of Handbook for Life, Dispelling the Myths of Parkinson's Disease, on the program.
This is going to be interesting
Yes.
because not only was he diagnosed with Parkinson's, but he's also a cancer survivor.
Wow.
I mean, he really was dealt not a good hand, but he remained positive, wrote a book called A Handbook for Life, and he's going to dispel some of the myths of Parkinson's. So it should be pretty interesting.
Yes, and then we have our friend, Dr. Latore, a Tampa-based ENT physician, and he's going to be in studio with us. So yay! He'll be here to discuss his doctor's take on Obamacare, you know, what he has personally seen and what he thinks and feels about that disaster.
And how it's affecting the industry.
Yes, and then we'll hear what's new in American Medicine Today, and maybe if we're lucky, he'll stick around and he'll chat with Dr. Grossmith about that. And up first,
In today's Back to Life segment, we will talk to a patient of the Bonati Spine Institute who went from living a life that was restricted by pain and discomfort through their journey of finding the Bonati Spine Institute and are now living pain-free.
well, it is my pleasure to welcome to the program Valerie Gambrell. She is a patient of the Bonati Spine Institute. Well, welcome, and thank you for being here and sharing your story with us.
It's my pleasure.
Why don't you start off by telling us how you came to be in pain? Was it an accident?
Slip and fall, just something naturally that happened? How'd you start?
I can tell you it's crazy. I was cleaning the house one day, just mopping the floor, and didn't think nothing of it. I felt the pain and went to sleep. But the following morning, I woke up and I couldn't feel my legs. I couldn't figure out what it was. So that was the beginning of my journey there of pain.
So let me get this straight. You were just mopping the floor. I mean, did you feel something pop? Did you?
I felt something pop, yeah.
Okay. And so did you go to your bed? Did you get bed rest? Did you think that you were going to need
Surgery?
I'm assuming after a couple of days and you were still in pain, you
Yeah.
decided to do something about it, correct?
Well, when I woke up I did go to bed. When I woke up that morning, that's when I said I couldn't feel my legs. And, of course, I couldn't go anywhere.
Right.
I went to the doctor that day.
Okay.
And from there, I went to have an MRI. So, because they couldn't figure out what was, well, I had an x-ray,
Okay.
and they couldn't determine from that, and then they sent me to get an MRI on my back.
And what did they tell you was the problem?
When I got the MRI,
Yes.
they just told me that I have a ruptured disc in my back,
Okay.
and that they said it was in the lower back, and that was in the L4, L5 area.
Okay.
And from that, I really didn't know what to do at that time.
How long did you suffer with that pain until you found the Bonati Spine Institute? What was that process like? How did you find Bonati?
Okay, I suffered with it for a couple of years.
Okay.
What I did was they told me I can have physical therapy. Didn't work.
Okay.
And also I went to chiropractor. That only did it temporarily.
Okay.
Had to learn how to get used to the pain. And of course, pain pills, forget it. But anyway, how I found out about Bonati, I've asked friends who's had back surgeries, and I heard the horror stories about their surgery, and I'm like, you know what, I'm not going to go through all that,
Right.
the surgeries that they had. So as time went on, what I did was I started checking. I heard about Bonati Institute,
Okay.
but what happened, a friend of mine where I work had surgery through another company. And so doctor's office, and I looked and researched that. And she also had surgery, but she had complications. I said, I'm not going to do that.
Right.
So when I kept hearing about Bonati and how Dr. Bonati invented the tools, I said, you know what, I'm going to try the doctor that invented the
Right.
tools. And the success rates, I said, that's where I'm going.
Right.
So
You got to see the innovator. Why would you ever see an imitator?
Exactly.
Yeah, exactly.
that's exactly right. That was my thought.
So Valerie, so you I assume you sent your MRIs. You came down to visit the institute in Hudson. How
was that like?
Yeah, what was your experience as you visited? I'm sure you had some anxiety and whatnot, correct?
Very much so. Back surgery to me was a lot because you hear about back surgery, how you can be paralyzed or whatever. So yes, I had a lot of anxiety. But when I went to Dr. Bonati, everybody, starting with Paul, was very friendly, and just calmed my nerves down.
Okay.
And from that step, even Kathy, the next person,
Yes.
I can name everybody, almost everybody that I experienced. They welcomed me like I was part of the family, which I appreciated.
Let me pause you, Valerie, because anybody, it just makes me laugh because I work there. So I've seen Paul. If you just look at Paul, you would think he used to be a New York City cop. He's a big burly dude. You wouldn't think he'd be that friendly, but nicest guy you'll ever meet.
Yes.
He is.
Doing this show must have cost Dr. Bonati a fortune because every patient we talk to raves about Paul. So if he gets a raise every time somebody compliments him, that man's doing well.
He's making a mint. So you were treated like family. I'm assuming they took you back, did the pre-op stuff. Kimberly?
You know, what was the evaluation process like for you? Did you feel as though the doctor was able to pinpoint where your pain was stemming from?
Right, but before the doctor, let me go to Elaine.
Okay.
She explained to me in detail what was wrong with me after reading my preliminary MRIs in.
Right.
She explained to me in detail. And then once Dr. Utek came in, she explained to me step by step by looking at my MRIs and told me where the pain was
Right.
and how he can relieve that pain by doing the surgery.
Okay.
All right, well, let's jump ahead a bit. Once you got up on the table for the procedure, Valerie, did you watch? It's conscious IV sedation, so you're relatively awake and aware. You can communicate back and forth with the surgeon. What was that like for you? Did you watch?
I did watch. It was kind of weird, but yes. I watched, and also Dr. Utek was talking to me. He was asking me, do I still feel pain? And the first one I said, yes, I still feel it. And then he said, how about now? And I'm like, no, I feel good. So, yeah.
So your pain went away
On the table.
On the table.
On the table, yes.
That's fantastic.
On the table.
So once your procedure was done, when did you start? How long was your recovery time?
Tell you the truth, I had 2 surgeries.
Okay.
And both of those surgeries, my recovery time was, I'd say a week.
Okay.
But 2 weeks for sure.
Right.
And bring us up to today. I mean, how
are you
are you
feeling?
feeling today?
Oh, I'm feeling marvelous. I am really fine. I am so pleased and so happy that I went to Dr. Bernardi.
You know, you can hear the marvelous in Valerie's
Marvelous.
voice. You can hear it.
You look marvelous.
Oh, yeah.
Well, that's awesome. So I'm assuming you would, since you had such a positive experience and positive results, that you would feel confident referring the Bonati Spine Institute to others, correct?
Yes, I've already started.
Oh, that's perfect.
I've already started. Yes, I have.
All right.
Well, Valerie, we have Dr. Grossmith of the Bonati Spine Institute, if you'd like to say anything.
Hi.
You know,
Hey, Valerie. Sounds like a great story, and glad you found relief.
Yes, thank you. I appreciate it.
Awesome. All right, Valerie. Well, continue.
Keep us updated.
Yep, keep us updated. Continued pain-free living, and we appreciate you joining us on American Medicine Today.
Oh, thank you. I appreciate it. Thanks for calling me.
You take care, Valerie.
Have a marvelous weekend.
You'll be marvelous. All right,
Bye-bye.
Valerie, I'll hang out with her.
that was great. That was good stuff.
You know, when you're researching back surgeries, and like she said, you panic because you
Terrified.
think it's right at the spine. You know, it could cause all sorts of problems. Well, the ones that are able to do it, the Bonati Spine Institute, Dr. John Grossmith, we have Dr. Uteg, Dr. Bonati, Dr. Hirschauer, great team that they have there. Go check them out. They'll help you regain your strength and motion and help you regain your hope. You're listening to American Medicine Today. Coming up after the break, we're going to speak with author Richard London about the Handbook for Life to Dispel Myths of Parkinson's Disease. Stay tuned. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden, I can cook, and I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thanks for sticking with American Medicine Today. I'm Kimberly Brumell, joined by our executive producer, Ethan Euchre.
Sitting in the big boy chair.
Senior fellow Jeff Wagstaff.
Sitting in the high chair.
No fair, he has Dr. Peppers joining us.
Diet Dr. Pepper.
Diet Dr. Pepper.
Gotta watch that waistline, my friend.
And we have board-certified neurosurgeon Dr. John Grossmith here.
Okay, I'm in the low chair.
Well, we have author of Handbook for Life, Dispelling the Myths of Parkinson's Disease, author Richard London. So thank you for joining us, sir.
Thank you, Kimberly.
And Richard, I understand that not only were you, and we'll get into the whole Parkinson's thing, you also are a cancer survivor?
Yes, I was blessed with a prostate cancer diagnosis, and then 2 years later with my Parkinson's diagnosis. So I'm now an 11-year cancer survivor and nine years into the Parkinson's journey.
That's unbelievable. And you've written a book called A Handbook for Life. You're here today to dispel some of the myths of Parkinson's. And a lot of people, when they think of Parkinson's, unless they know somebody or have a family member that has it or have it themselves, we don't really know much about it other than, it's a neurological disease. Michael J. Fox has it. Ali has it. How do you develop Parkinson's, and what are the symptoms?
Well, first of all, the doctors don't know how you develop Parkinson's. They say that there's a genetic component and an environmental component, which is their way of saying could be a little bit of anything that gets there. People with Parkinson's, the biggest thing is people see people with tremors. See Michael J. Fox with the flailing arms. One of the myths is the dyskinesia of the flailing arms that Michael J. Fox has is not a Parkinson's symptom. It's a side effect of the medicine. Muhammad Ali has what's pretty pronounced and typical what's called Parkinson's mask, which is where the facial muscles basically stop.
Or frozen.
They're frozen. You got it.
Yeah.
And so the Parkinson's mask is one. I guess one of the biggest myths about Parkinson's disease is that people think that Parkinson's is an old person's disease. The typical age of diagnosis is 60 and over. Young onset Parkinson's is classified by people under 50. I was actually 49 when I was diagnosed. 10% of the people with Parkinson's are diagnosed under age 40. And I personally know 3 people who were diagnosed in their 20s.
Wow, unbelievable. So how did you, what did you start noticing about your body that led you to the doctor to be diagnosed with Parkinson's?
Well, actually my doctor noticed it before I did. I had an essential tremor, a familial tremor, since my 20s, so I had always had a tremor in my hand, but he noticed some additional balance issues, some muscle rigidity, a little bit of the facial mask. He sent me to a neurologist, and the neurologist, there is no blood test for Parkinson's. Recently, they have what's called a DAT test, which is sort of like an MRI kind of scan, where they can look for dopamine levels in the brain. That was not available when I was diagnosed. There were only 2 ways to get a diagnosis of Parkinson's. One was an autopsy, and I was not going to volunteer for that.
No.
Nor should you have.
And the second, basically, is they put you on the gold standard Parkinson's medication, which is levodopa, and if you react favorably to the medicine, then by definition you have Parkinson's disease.
Okay. Can I ask you a question? When you said the doctor noticed like a tremor, how long would they last?
Well, it's what's called a resting tremor. In other words, you're sitting there doing nothing, and you're tremoring anyway, and it's constant and persistent. Now, different people have different manifestations of the disease. Most people do have tremor. Not all do. Balance and speech issues are part of Parkinson's. There's a cognitive impairment at some points. Depression is symptom of Parkinson's disease, and we all know what happened with Robin Williams, and that brought to light a lot about the depression in Parkinson's.
Now, Richard, as we mentioned, Muhammad Ali and Michael J. Fox are pretty much the face of Parkinson's, and other than that, that's really all we ever see about Parkinson's. And we could see, since they remained in the spotlight, that it's a pretty ravaging disease. Are there any ways to avoid some of the more debilitating symptoms?
Well, the medications that they have for Parkinson's only mask the symptoms as the disease progresses. And so for Western medicine, and I know we have a doctor here with us today, I define Parkinson's as a degenerative neurological disease for which Western medicine currently has no cure. There are other modalities in different cultures. I personally take a Tibetan herb that I've taken for 3 years that has been extremely beneficial. The best thing that I have ever seen to help fight back Parkinson's symptoms, more effective than anything else that's out there, is constant movement and exercise. Keep your body moving, stay active, and it's the old adage, use it or lose it.
Right.
Richard, in the information that Ethan put together for us today in anticipation of you being on the show, something that I think we should communicate to our audience is a public service, is that many people are diagnosed with Parkinson's at a young age, and that two symptoms, early warning symptoms, is one is a loss of smell, and the other one is when people develop sleep problems. So that was something that I don't think any of us would know that
either. And honestly, as a 35-year-old man who doesn't sleep at all, I mean, Kimberly knows, I talk about it all the time. That kind of scared me, and I have distant relatives that have had it. So are there any other early warning symptoms, Richard, for Parkinson's?
Sense of smell, actually, and sleep disorders are two of the earliest symptoms. The tremor is the most obvious that people see. Unfortunately, by the time there's physical manifestations of the tremor and other things, your body has lost a significant percentage, close to 70 to 80% of its dopamine production in the brain, and that's what's causing a lot of the problems. But those are some of the early symptoms to look for. One risk factor that people should be aware of is herbicides and pesticides, exposure to those. I actually have a friend of mine who has a twin brother. My friend was in Vietnam and exposed to Agent Orange. His brother was not. My friend has Parkinson's disease, for which the Veterans Administration has acknowledged the link between Agent Orange and Parkinson's.
Wow. All right, Richard. Well, I'd like to get a little more into the book. Unfortunately, we're out of time, but it's called A Handbook for Life. It's really positive message with this book, helps you develop and maintain a mindset to overcome challenges, and you clearly have overcome a lot of challenges. The website is ahandbookforlife.com. Richard London, thank you for joining us on American Medicine Today, sir.
Thank you so much, and you do need the ahandbookforlife.com. Thank you, Ethan. I appreciate it.
You got it, Rich. Have a great day.
You.
Unbelievable story, huh? Wow. Cancer, he basically beat that. Now he's battling Parkinson's. God bless him.
Yes.
All right.
Well, you're listening to American Medicine Today. If you or someone you know is suffering with neck, back, or sciatic pain, make sure you reach out to the Bonati Spine Institute, 855-267-0483, or visit Bonati.com. Coming up after the break, we have Dr. Randall Latore. He's going to be in studio with us. He's a Tampa-based ENT physician to discuss Obamacare. Stay tuned. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
You're listening to American Medicine Today. I'm Kimberly Brumell, joined by our executive producer, Ethan Euchre.
Here as always and happy.
We have board-certified neurosurgeon, Dr. John Grossmith of the Bonati Spine Institute.
Glad to be here. Hello.
And in studio to my side, we have Dr. Randall Latore, a Tampa-based ENT, and he's going to be here. He was already on once over the phone, but he's here to talk about Obamacare.
Yeah, oddly enough, he's somebody that Dr.
Yes.
Bonati wanted to have
Yes.
in, because when we had him on last time, we kind of chatted with him off air about
Yes.
it. And Doc was like, "Oh, we've got to have you come back in." And that sounded like Dracula, not Dr. Bonati. But unfortunately, Doc got sick. But we have Dr. Grossmith here. You know, we'll get a physician's perspective on that. You, of course, are a physician. Real quick, let's kind of recap what you do, because it's pretty incredible. Kimberly and I got to
witness the sinus balloon.
Got to go check it out. You want to tell us a little bit about the procedure and how that works?
Well, the procedure that I do in the office is really to treat chronic sinus disease. And instead of taking the patient to the operating room, now we can do these procedures in the office, minimally invasive, with the patient just slightly sedated. So that it's a win-win situation for the patient and us as physicians.
We had you on the TV show, so Ethan and I got to experience this, but it was so cool to watch this sinus balloon be inserted into the sinus cavities, and you could actually see areas on the face light up where this was. And you were saying you really have to have such knowledge of the anatomy because everything is so exact to where it's placed. And
yeah, some of the sinuses, I mean, if you God forbid poked through, right? I mean, you're into the brain or, you know, into the eyes and things like that, right? Very delicate.
Yeah, the anatomy is very delicate. It's very close in relationship. So you have to be very careful. You have to really know your anatomy.
Okay.
And really it's preparation,
Right.
both for the physician and getting the patient comfortable, which makes the procedure go pretty much flawlessly.
Right.
And this is mostly for people with deviated septums and things like that, right?
Well, it can help some patients with deviated septums, but the main goal is to really open up the sinus to allow it to drain and let air go in and out so that they don't keep suffering these chronic infections.
And so a lot of times people are, like myself, I have really bad allergies and I get completely stopped up where I can't breathe through my nose at all. Is that something that your procedure would help, or it would kind of unnecessary, because for the most part I'm okay most of the time until...
Well, you know, most of the patients come in with nasal congestion on top of sinus issues. So I do other procedures within that office time to actually help the breathing. So I can help your nasal obstruction, so to speak. At the same time, I open up the sinuses.
And it's great because they are awake, so they're able to communicate with you. And the patient that we saw was cracking
great.
jokes the whole time. So
Right. We try to keep it light.
Yes.
We keep music going and let the patient pick the music. Sometimes it's a little interesting what they pick.
Yeah.
It'd be punk if I was in there, punk or metal. Yeah.
Yeah, I see that in you. But I did have someone have house music, which was kind of a different
Oh,
thing.
how
But you
funny.
move a little bit faster with that music.
I bet.
Yeah.
So, and just before we get into the Obamacare stuff, a little more about your procedure. It's just a tiny little balloon, right? And it goes into the sinuses and it expands and it's permanent, right?
Correct. So we get the patient prepared. They're very sedated, but they can respond. That gives us good feedback. And we use a balloon that opens to the max amount of 6 millimeters. So I can take someone's opening of the sinus, which is a millimeter, and make it 6 millimeters, which is really a 600% increase in size. And it's permanent. The bone stays in that position, and nothing's actually left in the patient. There's no there's no packing, so to speak, which patients fear, and there's no real cutting
No
or removal
bruising.
of tissue. And if you looked at them right after the procedure and a day after, you would never know they had the procedure performed.
And you said they're like it's like controlled fractures or something
Correct,
of,
right.
of the bone, which kind of makes you cringe, but it doesn't really hurt, right?
No, the patients really, they may feel a little pressure, but once the balloon is deflated, the pressure is gone.
That's excellent.
Which is
And the procedure takes approximately how long?
the procedure takes about 15 to 20 minutes to perform.
Right.
I usually take a little bit longer just
To
to
numb.
prepare
Correct.
the patient. So I want it to be a nice experience so that they don't want to feel much, and I don't want them to feel anything as well.
Correct.
Gotcha. And we're a national show, but we're based out of the Tampa Bay area. If people in the Florida, well, really anybody anywhere
Wants to reach out?
wants to get a hold of you, they're interested in the sinus balloon procedure. How do they get in touch?
Well, you can call the office at area codes 813-908-8585. And for my Trinity patients, we have two offices, 727-375-8580. Or just go on the web and check out balloondoctampa.com. And that doc is DOC. So you can get more than enough information, streaming video, and some testimonials, which will kind of give us some credence.
Very cool. Excellent. Well, again, back to the whole reason why we wanted to have you back was Dr. Bernardi, of course, very outspoken about Obamacare and the effect that it's having on the whole industry. And he had spoken with you off air about your thoughts.
He
Go ahead,
had a
Kimberly.
couple of specific
Sure.
questions because I reached out to him on the phone. And, you know, his question was, you know, what do you think about the changes in medicine since the onset of Obamacare? And how is it affecting your practice? And have you lost any patients?
Sure. Well, since the first thing I want to mention is the lack of transparency, accountability, you know, when they rolled this out. And, you know, when it was first rolled out, they said that they had all these people that signed up through the website was actually overinflated.
Yes.
Some were double counted by 300,000 patients. So
Some
that
were
really
dental.
wasn't transparent. And about the affordability, we're now finding out that it's actually costing my patients more and at the same time limiting their ability to access health care. To give you an example, I'm one of few ENT physicians that accept that health insurance in the area.
Right.
But if I need to operate on that patient, I can't because I don't have privileges at the hospital that insurance company has aligned themselves with. So that limits the care I can deliver to these patients.
And let me ask you this. Why are you one of the few? Why don't
Right.
the other ones get involved?
I think most other ENTs, well, I'll assume, I don't want to speak for
Speak
my
for
other
them.
colleagues,
Right.
but
Sure.
I think they just don't want to be involved with the whole Affordable Care Act for principle.
Yes.
I kind of look at it as in a viewpoint where these patients need somebody to take care of them, whether they're enrolled in another private insurance carrier
Right.
or Medicare or the Affordable Care Act. They don't have anywhere to go.
But how good is it, though, when you see them and you're able to do everything up to a certain point, and then when it comes to the actual surgery that they need, and probably with you, how does that make you feel knowing that your hands are tied?
You know, it's the opposite of why we entered medicine. We wanted to be able to help our patients and have no limitation. But in the back of our minds, we always want to limit costs.
Right.
We always want to limit procedures, do no harm. But we're handcuffed. And I'm frustrated. The patients are equally frustrated. And then they have to start over.
Right.
They may have to find another physician that accepts it, that goes to the hospital, so they start all over again.
Well, then is it really beneficial to the patient if under the premise that they have insurance, they come to you to seek help, they get your guidance and your knowledge, and they're ready for what's going to really help them, and then, hey, you have to start over, and then maybe they're going to be at another doctor that's not going to offer the services that you do, and they may not get that, 98% satisfaction,
exactly.
The success.
And that's a very big problem that the patients are finding out after the fact. Yeah. And I emphasize after the fact.
Right.
Here's what gets me. And, I do know some people, people at the radio station. My wife manages a salon. She has some of the girls there that they're psyched about Obamacare. They think it's awesome because, they don't make a lot of money and they never really had access to health care. They think that it's one of the greatest things ever. What they don't understand, and correct me if I'm wrong, but I've been made privy to the fact that a lot of times if you have that affordable care, that's your insurance. You go see a doctor. Another patient comes in who has top of the line, great insurance, and you probably won't be able to comment on this because you're a doctor and you don't want to admit this. But I've heard as a rumor that the doctor's probably going to see the person with the great care first, insurance first, rather than the Obamacare person. So they're going to wait a lot longer. Is there any validity to that? Can you speak on that at all?
I think there may be some slight truth to that statement. I can't tell you that in my practice, and I won't speak for anyone else's practice, but I do think that there may be some limitations when there's an association with the Affordable Care Act or Obamacare, which is unfair.
Yeah.
And it's not, but life's not fair, unfortunately. This is how it is.
Sound like my mother.
But, it is limiting.
Yes.
And that's the problem when I think many of the American public were fooled by the rollout and by what it was going to give them from the beginning, that you could keep your doctor if you like your doctor. That is not true.
Biggest lie of the year.
How much time do we have left in the segment?
About a minute and a half.
Okay. Well, then
we can roll it.
After
in the next
that, we're going to
segment.
roll it. Yes.
Yeah. There's some great audio that we found. We were actually talking about it at length last week about the death panels and Jonathan Gruber and this and that. I found sort of a mashup on YouTube where they're, we all know that they were making fun of Sarah Palin when she came out and said, in quotes, the death panels, and that became an object of ridicule, and
only to find out it's true.
Looks like they might be coming. So we'll roll that in the next segment. So you can hang out, right, Dr.
Sure,
Latore?
absolutely. Love to.
Great.
Okay,
and then
cool.
we're going to hear more from Dr. John Grossmith.
Absolutely. And if people want to get in touch, Kimberly, how do they do so?
Well, if they're suffering with neck, back, sciatic pain, RSD, they can reach out to the Bonati Spine Institute, 855-267-0483, or visit Bonati.com. Now, keep in mind, we have a Twitter account, so if you're online, you can tweet at Dr. Bonati or hashtag AMT. And for those of you that may not know, we are national on Bloomberg, so check your local listings Saturday and Sunday evenings. And then we're on locally here in Tampa on ABC WFTS 28 at 7 p.m. Saturdays, so make sure you tune us in.
My mother gets to look at my ugly mug all the way up in North Carolina. She's
I
pretty
bet
psyched about
she's
that.
proud of her baby boy.
She loves it.
Coming up after the break, you'll hear what's new in American medicine today. Stay tuned.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome has been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thanks for listening to American Medicine Today. I'm Kimberly Brumell, joined by our executive producer, Ethan Euchre.
I am here, indeed.
We have our esteemed board-certified neurosurgeon, Dr. John Grossmith, joining us today.
Hello.
And in studio, we have Dr. Randall Latore, top Tampa otolaryngologist. He's a top ENT in Tampa, and he's here to discuss further all the debacles with Obamacare.
Yeah, we were talking about it last break. Yeah, thank you, by the way.
Well, thank you for having me.
He went to say something, and I had to open my big mouth. But yeah, we were talking about at length last week, death panels.
Yes.
And Gruber.
Roll it.
We found some audio.
Some of people's concerns have grown out of bogus claims that we plan to set up panels of bureaucrats with the power to kill off senior citizens. It is a lie, plain and simple. Plain and simple.
Nothing has drawn as much controversy as the so-called death panels.
There are no so-called death panels.
There is no death panel.
Death panels, the lie of the year.
I heard that death panel argument from Sarah Palin.
Such a charge would be laughable.
Just another example of President Obama lying.
We weren't so cynical and irresponsible.
Deceiving the people.
Deception, does that include the death panels which were never real?
The shocking truth about Obama's health care plan.
Sarah Palin called them Obamacare death panels, and she was vilified for it.
Don't you know, she was right.
A growing number of Democrats proving her right, like former Democratic National Committee Chairman Howard Dean.
Who also happens to be a medical doctor. He is screaming to high heaven. A, quote, major problem with the Independent Payment Advisory Board, essentially a healthcare rationing body.
Bottom line, if they don't have a whole lot of years left, is it worth providing them costly medical procedures now?
Maybe you're better off not having the surgery, but taking the painkiller.
We're going to get the real solution, which is going to be a combination of death panels and sales taxes. We're actually going to take Medicare under control.
Nobody's pulling the plug on granting.
Take Medicare under control.
There's no government takeover.
This entire health law is a death panel.
Death panel? You're looking at it. Remember the case of Sarah Murnahan, that 10-year-old girl who wasn't allowed the adult lung transplant because Kathleen Sebelius wouldn't sign off? Did that sound like a death panel to you?
The little girl is a prime example of a bureaucrat being able to make that decision is a scary thing. This bill was always going to lead to rationing, but the important thing to remember is that's just one aspect of Obamacare.
I know that sounds scary to many folks. It sounds scary to me too.
Why wasn't there just more honesty through this whole process?
Unbelievable.
Yeah. So as doctors, both Dr. Latore and Dr. Grossmith, doesn't that anger you
Dr. Grossman?
I guess what I would say is a continuation of what I've said in another segment, in which there's this book. And another segment of this book would be under our Constitution. And I would say this: no state shall make or enforce any law that shall abridge the privileges or immunities of citizens of the United States, nor shall any state deprive any person of life, liberty, or property without due process of law, nor deny to any person within its jurisdiction the equal protection of the laws. So what would be the point of all this? Well, if you start to ignore inalienable rights, and if you start reducing some of these basic justices, meaning the right as a human being, you have life, liberty, and pursuit of happiness, and reduce it to a constitutional right, and then you make an error in the logical reasoning to make a decision to form a positive law, which would be defined as a law that is what man makes for people to govern people, then you get in a situation where you have a decision like Roe versus Wade. Because under Roe versus Wade, we're hiding behind, well, when does life begin? Right. Well, we've had a long historical story as to when life began before we got into our higher technology. And in this day and age, there's no doubt that life begins when you have a genetic code formed, and that genetic code forms when you have the zygote, which is in reproduction. So basically, we have life. And so under the Supreme Court's decision, they've said, well, we don't know when life begins. And so they say what trumps that is the mother's right to decide. And so a decision for privacy or rights trumps life. So if you can get away with that kind of decision, well, it shouldn't be a shock that you couldn't alter a lot of other things. Because once you start violating the principles of reason, ethics, you're starting to get into the world of anything can go.
Right.
Well, what I've always thought, and Dr. LaTorre, maybe you can chime in on this, is that, I mean, we've always, since the rollout of Obamacare, thought, how can this be constitutional? How can the government tell you that you have to buy something?
Yes.
That just seems like something that, you know, out of science fiction. How can they tell you that you can buy something? And then we've had attorneys on that have explained it went all the way to the Supreme Court.
And they said it's a tax.
And they ruled that it's a tax.
Yes.
So they're pretty slick with you know, how they justify these things.
Well, first of all, you know, they've covered it up without saying it is a tax.
Right.
You know, and they've counted on, as Mr. Gruber said, on the stupidity of the American public. And the goal was to get this thing passed, and we'll figure out everything later. That was the whole point. And this was said, you know, in a speech by Mr. Gruber. And the problem is that the American people were duped.
Right.
Yeah.
And now we're in the situation where if you use the word socialized medicine, that sends fear and shivers up everybody's spine.
Right.
You know, that's why we had Canadians coming into the United States for health care and other nationalities coming in for health care in the United States. But now, in essence, what we're creating is a socialized medicine, whether we like it or not. And, you know, I think the Obama people put the cart before the horse. And now we need to make some changes. And thank God we have a majority now in the House and the Senate to hopefully sort of make some changes.
Yeah.
Well, not only that, Kimberly, but we should also, and I can't believe we forgot to mention it last week, but U.S. Congressman David Jolly, who's a friend of the show, he has crafted bills that last time we had him on, he was trying to push through, which isn't going to repeal Obamacare, but it'll...
Small steps, it chips away.
It's baby steps. He's trying to repeal the mandate that there's a fine that you'll have to pay if you don't enroll.
Then there was something else just passed by Jolly where it limited this mandate. They're saying if it's full-time, they made it for 40 hours versus 30 hours.
Right, because
so that should help some people.
Yep. Initially, they were saying, you know, that it's 30 hours a week. Anything over that, you're considered full-time. And so a lot of places, a lot of businesses were cutting their hours back so that they fell under that. It's It's just ridiculous. Bob.
And we just played that soundbite, and they're talking about the Death Panel's Independent Payment Advisory Board. Doesn't it sound sweet and kind? Dr. Grossmith, go ahead.
I also wanted to bring in another piece of information. Basically, this is a particular policy. I won't mention the company, but what I'll say is that on this particular policy, the individual deductible is $5,000. The family deductible is $15,000. And then when you start looking into out-of-network provider, it's the deductible plus 50% co-insurance. So when we start getting into what they call balanced billing, if you have a $1,000 bill and you're in that zone, they may pay $500 of it, and then you pay the other $500. The cost of this particular insurance for the husband and wife is $1,582.21 a month.
That's
And
unbelievable.
so now when you start looking at that, and you're on a fixed income, or you're at where you don't have a job, or you're working 25, 30 hours, how do you pay for that? So instead of a death panel, economically, you could be set up like this. So this policy is mine and my wife's, but what about the guy that's out there struggling or got laid off on a job, et cetera, et cetera? It's not necessarily that these are the numbers, but you can see if you didn't have an income or you had a lowered income, instead of having a panel, it's done economically. It's like, okay, I can't afford to buy the medication to treat my condition. I can't afford to go see a provider that could treat my condition. So having external forces like that can really make a major impact.
It certainly can. It'll drive up depression, and maybe they won't need to have panels. They'll just off themselves.
Yeah.
Sad, but it's true.
Well, that'll do it for this week.
It is. You're
Yep.
listening to American Medicine Today. Tune in next week and keep an eye out for us Saturdays and Sundays nationally on Bloomberg and locally WFTS ABC 28 Saturdays at 7 p.m. See you next time.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden, I can cook, and I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.